One of the things that we get asked a lot about is why did we open up an urgent care? First and foremost is we heard from a lot of our patients that improving access to preventative healthcare services was very important here in Union County. And as an industry and as a country, we're trying to grapple with this concept of healthcare costs. And we know that receiving care in an ER is certainly expensive. And so we already had a walk-in clinic here in Union County that was commingled with our 4th Street Clinic or Regional Medical Clinic. And so as we started evaluating our Regional Medical Clinic and with the anticipation of 5 new family physicians coming to town, we really were starting to run out of space. Not to mention that our walk-in clinic had grown in terms of the volume and its popularity.
Dr. Porter and the administration at Grande Ronde Hospital were able to kind of look at the overall situation, and they decided that really Union County needs a standalone urgent care. And so they worked together to find the right space and the right setup, and voila, here we are. And that transition happened this fall around September, October time period, and it's been almost, again, too successful. We're really busy. And we're really able to serve a lot of people. And I can tell you that every single day that I've worked here, someone has thanked me just for being here. People are very grateful. I think this was a service line that the area really needed. Our ER is busy. We're a busy, thriving, emergency department. And we really find across all geographic areas that communities that reach a certain size, if they don't have a good urgent care infrastructure, what we see is those really primary care walk-in patients who should have been seen or could have been seen in a clinic setting, they end up in an ER setting. Our ER providers need to be ready to treat those heart attacks and those strokes and those car accidents and those really big events in people's lives where you need a big team of people to spring into action and jump all over the situation. That's what they need to be ready for. And it's not really in the best interest of the patient either to have to go to the ER and wait. And to be frank, from the patient perspective, pay that bigger ER bill for something that would have been very appropriately treated in an urgent care setting.
Once we got approval to move forward with the project, having a local foundation was instrumental, knowing that they were going to provide some additional financial resources to help us bring that vision to reality.
Since the urgent care had originally been conceived, the whole idea of it had been conceived, the question had been, would the foundation want to be involved, or could they be involved in some way in funding that? What might that look like? Does it pay for part of the construction? Does it pay for this? Does it pay for that? But then there was this singular piece of equipment that definitely had that high dollar value that we could definitely attach ourselves to. So we were super excited about that and wanted to be part of it.
One of the most exciting recent developments that we've had at Urgent Care is the acquisition of our X-ray machine, thanks to the work of our foundation and the generosity of an anonymous donor.
We had a write-up in the Life and Health newsletter that came out, and that fall we got an initial gift from that donor, and we reached out to them, said thank you, and then a couple months later we got notification from their financial planners that they wanted to make a significant gift in the form of a mutual fund, and lo and behold, we made that happen, and it was a grateful thing. And the thing that prompted that is that they loved the idea of the urgent care and having the X-ray capabilities within the urgent care. They liked the location of it. For all the reasons I mentioned why Grande Ronde Hospital wanted to do it the way we did it, they were on board with that, and they wanted to help fund that. They had the means to be able to do something good with that. They saw that in the newsletter and said, hey, let's back that. That's a great idea. Let's back that. And so they contacted us, and we helped them get it done.
So let's say we have, we've got a 13-year-old boy who was playing football and falls down and hurts his wrist. And he's not sure, is it broken or not? It looks sort of okay, but it hurts and it's swollen and they think it might be broken. Previously, if he came to urgent care, we could absolutely do a great physical exam, put him in a splint, send him, to drive across town over to the hospital to have an x-ray and then read the x-ray results. And if we found a fracture that needed, a different splint or some kind of more attention, we would have to call that patient up and ask them to please come back to urgent care to get the treatment that they need for that fracture. Now that we have an x-ray machine on site, we can see that patient, examine him, get the x-ray, review the result, and send him out with the exact right splint right then and there without him having to drive anywhere to make that happen. And in addition to that, because we are an urgent care center that exists in a bigger hospital system with access to specialty care, if that kid is going to need a cast or surgical follow-up with an orthopedist, we can also usually send them out with that follow-up coordinated right then and there. So it really becomes more of a one-stop shopping experience, if you will, that provides a lot more convenience, a lot faster care, and a lot more complete care than we were able to provide before.
Having a strong foundation, I think, often gets forgotten in the overall scheme of a local hospital. Being an independent hospital is tough. The foundation and the support that we have received from them, as well as the support that the foundation has received from the community, has been instrumental in us being able to fund additional projects that, again, improve access to care, improve quality of care, improve our infection control processes.
Without a strong hospital foundation, we sometimes struggle to get the things that we need to take care of our patients. If you look at our x-ray machine, in a community, in our urgent care, in a community of our size, seeing our patient volumes, we're not generating the big bucks, to put it bluntly. Like, we don't always see the volume where if we were, owned by a hedge fund in California, does this x-ray make sense financially? Bottom line, are we going to make money by bringing this x-ray in? Probably not, right? And so without a foundation, how do we get big capital items that may or may not pay for themselves? Is it the right thing to do for our patients to have this x-ray machine? Absolutely, right? But if it's just dollars and cents, is it going to pay for itself? Maybe not. And so that's where a foundation comes in to help us get tools like x-ray machines, or sometimes we end up getting things like new OB Dopplers or different equipment that we need to take the right care of our patients, because it's the right thing to do.
And that's one thing I love to be able to do, is be able to connect people who have the means to help with the passions that they want to help with, whether that be buying an x-ray machine for an urgent care clinic, providing care for kids or cancer patients, or whatever the case may be. We love to help make those connections and make those things happen.
Grande Ronde Hospital Foundation. It takes a solid foundation to build a strong hospital.